Hi, good afternoon, and welcome to a session on IVF Myths. Let's debunk. We're glad to have Dr. Renuka among us to help us understand this topic. In vitro fertilization is a complex series of procedures which help us with the fertility or prevent genetic problems and assist with the conception of a child. But there are still many myths floating around about this topic. So it's best for us to get this information from a doctor itself. So we are glad to have the doctor over here to dispel these myths. Doctor, you have the stage.
Good afternoon, everyone. I'm Dr. Renuka. Today, I will try to discuss about the wrong conceptions what many people have regarding IVF. So, we all know that infertility is a psychosocial problem. It is very less related to your health, but it is a what you can say. It's a psychological and a social problem, which puts a couple under a lot of stress, and all couples are not fortunate enough to have a pregnancy naturally or with the basic level of treatment. There are certain group of couples who need little higher level of treatments like IVF, ICSI, or third party reproduction. So when we suggest these kind of treatments, they have lot of things in their mind. So first thing what they get into their mind is this is the only way with which we can conceive. So there are certain indications or certain reasons why we do IVF for a particular couple. Some of them could be like in a woman when her fallopian tubes are blocked, or when her egg count is very less, or her age is little more advanced, or when they have certain conditions like endometriosis, especially when they have grade 3 or grade 4 endometriosis, or when they have multiple fibroids where they have undergone some surgery for removal of these fibroids, and before new fibroids they come up, we have to see that the woman conceives. So before that, we advise them to go with IVF so that they can conceive quickly before they need one more surgery. And in men, certain conditions like where they have very low sperm count, or very low sperm motility, or when the sperms are almost all the sperms are abnormal, or when there are no sperms at all. These are some common indications or some common reasons why we advise IVF for some couples. And there are one more reason called unexplained infertility, where the couple will be suffering with infertility for a prolonged period of time, in spite of being their reports normal, and still they cannot conceive, because with routine evaluation or even with advanced evaluation what we do, we cannot always find out the reason, because there we cannot explore all the areas of human reproduction with the current technology what we have. There are many things which are yet to be explored, and we need much more development in the technology to find out what the reason could be for certain couples. So simple test or simple evaluation may not show us that reason. So even for such kind of couples also we advise IVF. And one more special condition where we advise this kind of treatment is couples who face repeated pregnancy losses, or couples who have certain genetic abnormality in either of the couple, or some genetic abnormality in their previous children, or some genetic abnormality in their family. For these group of patients, we advise IVF so that we can select the best embryo and use it to have a pregnancy, so that the couple can have a healthy and a successful pregnancy. And being these the indications, once we tell that the couple need IVF when they have any of these conditions, they usually have many doubts in their minds, and which they hear from other doctors, or sometimes their friends, or from their relatives, or some patients who have already undergone IVF, and they will have many unanswered questions. which they get confused or they don't know to whom they have to ask. Because of this communication barrier, many of them, they don't approach the doctor for having timely treatment, and they lose that golden period where they will have maximum success rate with this particular modality of treatment. Though this IVF or ICSI, this has been introduced, this kind of treatment has been introduced 40 years back, which was in 1979. The first IVF baby was born in 1979, 40 years back. Even after 40 years of this introduction of this treatment, still many of them have misconceptions about this treatment. So in this today's talk, I will try to what you say clear those misconceptions as much as possible. If you have any other doubts other than what I discuss, you're free to ask after I complete my talk. So the first question or the first thing which comes to mind when a couple is advised for IVF is it painful? Is IVF painful? That is the first thing they are scared of, the pain. Is it very painful, or how severe will be the pain, and all this is the first question they ask. So I don't say that it is painful, but yes, it may give you little discomfort to you because you have to take injections on a daily basis for a short period of time, say for 8 to 9 days at a stretch. Daily injections, maybe sometimes 2 injections in a day. So the pain what you get with injections is the only pain you get during undergoing this treatment. And nowadays we have very much advanced formulations where we get it in pen form, where the needle is very thin and it is very easy to take these injections. Even you can take these injections by yourself. They are very comfortable, you can carry it very easily. And if you're not able to take them also, you can have some assistance, some nurse to administer it for you, and they are very less painful. So being IVF painful is again not true. It is little discomfort but not painful, that you have to avoid this kind of treatment. And the second most common question or common doubt couples express is about the side effects. Yes, we are giving you certain hormonal injections to have maximum output from a single cycle. So they get worried about the side effects of these hormonal injections. Many couples, once they hear or once they learn to know that they are given these hormones, they really get worried and they think that they will have very long term side effects, something like weight gain or severe side effects like uh, disturbance in their metabolism or many of such kind of things. But again, it is not true. The side effects are very short term. Usually they start when your hormone levels start raising because of multiple eggs growing, which usually starts from fourth or fifth day of taking your injections. So maximum you will have side effects with these injections for a period of 4 to 5 days. That too very mild side effects, like you may feel more warmer and you may feel get more sweatings, or you may have little tiredness, or you may get tired little easily, or you may feel little drowsy when you're taking these injections, and which is for a very short period. And you have to understand that the hormones what we give are the natural hormones which are already present in your body naturally. Usually the hormones, they are sufficient only for growth of one single egg. But in IVF, we want as many eggs as possible in a single cycle, so that we get maximum output or maximum result from a single cycle. So we give the same hormones which are there in your body, but at a little higher doses, because of which you will face these short-term side effects like hot flushes or tiredness and all. And once the injections are done or once the egg pickup is done, you may not feel any of these side effects. Only thing which you need to worry about is little hair fall will be there, and again that too for short term, maybe for after 2 or 3 months you may experience little more hair fall because of sudden raise of hormones and sudden drop of these hormones, again which you can overcome by taking good diet and taking good rest and having good sleep and reducing your stress levels. Even these side effects can be handled very easily with not much difficulties. And the third most important fear what the especially the woman has is about the egg pickup. Most of them, they think that the procedure of egg pickup is a major procedure where it is a complicated one, and they need some stitches and all, and they need some rest, and they have to be on rest for say 7 or 8 days, or say 2 weeks, like how they have to be on rest for while they undergo some cesarean or something like that. Again, it's a big misconception that egg pickup is a painful procedure. Actually, we do this procedure under anesthesia, and again you have to remember, we give anesthesia. It's not because it is painful, it's because we don't want you to move during the procedure. Any mild movement from your side, we may puncture the adjacent structures while doing the procedure. So we don't want any movement from your side while doing the procedure. So to make you immobile or to make you relaxed totally and do the procedure without injuring the surrounding structures, we give anesthesia so that you will be lying down without any motion. So we can actually do the procedure without anesthesia also, because it's not painful. It is a very simple procedure where we do it through your natural passage, that is vagina. We put a scan probe and we put a small needle, like similar kind of needle what we you use to take your intramuscular injections, almost the similar kind of needle but little longer, so that it should reach the ovary and the eggs. So we put that needle through the scan probe, and through that needle we take out the eggs. So even after the procedure, you don't need any stitching or suturing or nothing like that. So when you don't have any stitches, you will not have any post procedure pain, but you may have little discomfort in your lower abdomen because we have picked so many eggs from your ovaries, and your ovaries are a little punctured. They may be releasing some chemicals which help in repair of the surface of the ovary. Because of this, you may feel little discomfort, something like bloating kind of sensation or heaviness in your lower abdomen, which can be again handled with a simple painkiller like paracetamol. You don't even need a higher painkiller than paracetamol. Hardly for 1 or 2 days you can take that paracetamol to reduce even that mild discomfort. So you need not get scared about the procedure, because we always prefer to do it all, and we always do it under anesthesia, and you will not have any suturing or cutting in this procedure, and it is again done through your natural passages. So you can just remove that fear from your mind that it is a painful procedure. One more misconception which is common, very common, which patients have is that they have to take rest while they are undergoing the treatment, while they are waiting for the result, and while they conceive with this IVF treatment. Again, it is totally a wrong conception, a misconception. You need not take any rest, or you did not be in complete rest or complete bed rest while you're taking treatment, or even after embryo transfer, or even once you conceive with IVF treatment. In fact, taking too much of rest, being on complete bed rest, is more harmful, because when we are giving you this IVF treatment, or when you conceive, or even if it is a normal pregnancy, even without IVF, usually because of the hormonal changes which are there, which happens because of the pregnancy or because of these IVF injections, whatever, your hormone called estrogen, it gets little elevated, than the normal. Even this happens even in your not natural pregnancy, even if you conceive naturally also. So this estrogen hormone will uh, create an atmosphere in your body such that your blood clots little quickly, so your blood becomes little thicker, so it tends to clot easily. So when you're under total bed rest or complete bed rest, the tendency to clotting will increase further, and the blood may clot in various parts of your body like your calf muscles and all, which is more dangerous. So it is not at all advised to be under complete bed rest while you are undergoing IVF treatment, or after your embryo transfer, or even after you have conceived with IVF treatment. You should be active as much as possible. You can attend your work either at office or at your home. You can do all kind of activities which your body is already used to. You cannot start any new kind of workouts or works which your body is not used to, but you can continue doing any kind of work which your body is used to. If you are having any discomfort doing a particular kind of work, you can just avoid that kind of work, but you need not be, it's not like you have to be under complete bed rest. Many couples, they get scared that they have to leave their job or they have to stop taking care of their home when, if at all, they undergo this IVF treatments, and they take a back step for taking the decision of for fulfilling their dream of having a child. So one more misconception which you need to clear is that you don't need absolute bed rest. It is always best, and the results are better if you're active physically and if you're continuing with your routine work. The other misconception what they have is about the babies born out of IVF. Most of them, they think that because of the IVF treatment itself, the babies will be little weaker, or the babies will have little more chances of having abnormalities. According to many research papers, according to many evidences, throughout this 40 years of period, many babies were born, and many research has been done on these babies even until 20 and 25 years also. So no, there is no evidence stating that babies born out of IVF treatments have more abnormalities than the babies born naturally. So the abnormalities, the risk of having abnormalities in the baby is same as babies who are born naturally without any kind of treatment. If at all a couple is having a miscarriage or abnormal pregnancy when they undergo IVF treatment, it is not because of the IVF treatment per se. It is because of the reason why they had to undergo IVF, the problem for which they have undergone IVF. That is the reason for the abnormalities or miscarriages what they face. Because when we are doing IVF, we are trying to cross the natural barrier and creating a pregnancy. So the natural barrier, which is the reason for the couple not able to conceive, that is the reason for having some abnormality in the pregnancy or some abnormality in the baby. It's not the IVF procedure per se which increases the chances of abnormalities in the babies. In fact, as already discussed, in couples who face recurrent pregnancy losses, or in couples who have an already abnormal child, or they have abnormal child in their family, or one of the couple is having some any abnormality in their genes, they are much more eligible couple for undergoing this procedure, so that the genetic problem stops at that generation and it won't be carried to the next generation if at all they get IVF done. So we screen the embryos, or we test the embryos, and we select only the healthy embryos where all the genes seems or looks normal, where we get a normal report of their genes. and then only those embryos we transfer, so that the genetic problem will be stopped at that particular generation, and the next generation will not face the same kind of problem as the parent or the previous child had. So in fact, IVF can solve certain problems where the babies had some abnormalities in these kind of families. So again, you need not worry about having an abnormal baby just because of IVF procedure. So you can be very clear that IVF will not give any abnormalities in the baby. And the sixth most common misconception is, most of them, they think that uh, they have to take more medications when, if at all, they undergo this IVF procedure. They think that they have to take a lot of medication or injections, or they have to be under close monitoring, something like they may have to get admitted and for the close monitoring and all, and they need extra procedures and all in pregnancy. Again, this is also a wrong conception. In IVF pregnancies, you need little closer monitoring initially for until says 9 to 12 weeks. Until 9 to 12 weeks, you need little extra support, because we have created a pregnancy in an artificial environment, and we have, and it needs little support. After 9 to 12 weeks of pregnancy, usually the amount of medication what you take is almost similar to the medication what we give in a natural pregnancy, unless you have some chronic health issues, then only we add some problems, or if you have any previous failed pregnancies, then only we give special medicines other than routine supplements like what we give in a natural pregnancy, like iron, calcium, and multivitamins. So usually it's not more than these three medicines what we give, along with regular vaccination. Even in IVF pregnancy, only women who have special conditions, only for them we give a little longer period of support with, say, the two progesterone hormone, in because in certain women this hormone is deficient, which results in certain miscarriages and all at say around fifth or sixth months. Only that group of women we give little extra progesterone other than iron, calcium, and vitamin. Again, you need not worry about taking a lot of medicines because you have undergone an IVF procedure. Only until 9 to 12 weeks, you may need little extra medication, little different from the woman who had a natural pregnancy. That too, just one or two tablets extra than natural conceptions. And one more misconception what many of them have about is, they think that IVF can solve all the fertility problems. So again, this is not right. There are certain problems which cannot be sorted out by even this IVF procedure, if the woman is not having the uterus, and woman is if the woman is not having any eggs of her own, or when we have tried to extract the sperms from the husband and we don't get any of the sperms, or we get only immature sperms from him. These are certain kind of conditions where this IVF procedure with self gametes, like their own egg, their own sperm, or their own uterus, may not work for them. In these conditions, they may have to go with third party reproduction, where they need donor egg, or they need donor sperm, or they may have to go for surrogacy if the uterus is at fault, or when if the woman is having severe health problems where she cannot carry a pregnancy by herself, where doing IVF itself, or doing putting an embryo into her uterus is more harmful for both her and the baby, then also it is better to go with surrogacy rather than undergoing the IVF procedure. So you have to remember that IVF doesn't solve all the fertility issues. So this is also one conception many people have. misconception which many people have when they hear about IVF. And other thing is, maybe you might be hearing through many media, like either radio or brochures or whatever. Many of them, they say, or they market like you will have 100% success rates, or say around 80 to 90% success rates with an IVF. Again, which is not true. So even if in the best IVF center in the world, the success rate of IVF treatment is said to be around 40 to 50% in first cycle, or well, precisely to say, in first transfer with one embryo transfer. The average success rate of an IVF cycle is about 40 to 50% maximum. It's not only in India, it's the same all around the world, even in the best IVF center in Australia, UK, or US, whatever. So maximum success they claim is around 40 to 50%. And we have uh, good centers like Apollo, which is on par with these success rates, which are seen in the all around the world in the best IVF units. So you cannot expect a 100% success rates, because there are many areas which are yet to be explored in human reproduction. We don't have complete technology to know what the reason is why the couple couldn't conceive. We cannot always find out the reason. When we don't know the reason for 100%, then you can't give the success also as 100%. So there are many unexplored areas because of which we are not able to reach that 100% mark. Eh, leave about 100%, we are not able to cross 40 to 50% mark for now with the current technology what we have. So you should be very careful while you're selecting your IVF center. Don't fall for the marketing strategies who say that they can have 100% results or 80% results. With one embryo transfer, the maximum result you can have is 40 to 50%. Again, the success rate, it varies from couple to couple. For some couples, they may have only 5 to 10%. Some couples, it may come around 50 to 60% also, depending upon the various factors which we look into before starting the IVF treatment. So you have to keep this in mind, that IVF doesn't guarantee 100% success. It varies, and the success what you have is different from the success what other couple has. And one more doubt or misconception what certain couples have is about the long-term side effects, especially the risk of having cancers with IVF treatments. Again, this is not true, because as already discussed, IVF treatments will have only short-term side effects. It doesn't give you long-term side effects. Chances of having cancer is not because of the IVF treatment. Usually, patients who undergo IVF treatment have high level of hormones, especially these estrogen hormones, because of their endometriosis or PCO or their obesity, etc., etc., which put them under risk of having breast cancer or uterine cancers. Even though a woman did not undergo any IVF treatment, if she has PCO, if she has obesity, if she is having endometriosis, these conditions, she is at risk of getting uterine or breast cancers because of these risk factors itself, even though she did not undergo IVF. So having increased chances of getting cancers because of IVF treatments is again not true. And one more misconception what couples have is that they have to undergo cesarean for the delivery. Every IVF pregnancy, it is delivered through cesarean only. Again, this is a very big misunderstanding. It's not so. Usually, the decision for delivering either by cesarean or normal delivery is made based on the condition of both mother and the baby. If the woman is having a single pregnancy and she doesn't have any complications and she goes into labor normally without any complications, we can always try for a normal delivery. If a woman has any other complications like blood pressure, diabetes, or if the woman is having a twin pregnancy, or the age of the woman is little advanced, or the baby is having any growth issues, or the liquor is less, in these conditions, even though if it is not a IVF pregnancy, we may have to go for a cesarean. Only thing when we have an IVF pregnancy is getting an IVF itself it's a long journey where you might have put lot of your emotions and your finances into it. So we always see that the your investment doesn't go waste. So we may take little early delivery or early decision while delivering your babies, because your baby is so precious, because you have undergone lot to conceive this baby. So we may take little early decision when we deliver the baby. We may not wait for prolonged period to have a normal delivery. We see that we deliver the baby with zero risk. So in that way, there may be little higher chances of having cesarean, but it's not like delivery will be always by a cesarean. You can try for a normal delivery if everything, or if everything else is fine, and there are no risk factors, you can always try for a normal delivery. Again, one more misconception is many couples, they ask that because we are going for an IVF, is it always a twin pregnancy? Again, it's not true. Whether a pregnancy is single pregnancy or a twin pregnancy, we can always control it. Usually, we advise couples to go with a single embryo transfer, because handling a singleton pregnancy is much easier. The complications during the pregnancy are much less, and it is easier to deliver a single baby than doing a twin delivery or a triplet deliveries. So we always advise the couple to go with a single embryo transfer. But there are certain conditions where we do two or maximum three embryos. We do this transfer of two or three embryos, like women who are little of advanced age, like more than 35 years, or women who had previous failed transfers with a single embryo or two embryo transfers, or when the embryo quality is not up to the mark, say grade 3 or grade 2 a kind of embryos. In these kind of embryos, we may transfer maximum 2 for women who are less than 35, and maximum 3 for women who are more than 35. Again, after discussing with you, if at all, if you're okay with a twin pregnancy and all. If you are say that, or if you don't want to have a twin pregnancy at all, we always prefer, and it is always best to have a single embryo being transferred. So it is again a misconception that when you have an IVF pregnancy, it may not be always a twin pregnancy. We have to decide like how many embryos we have to put, and before putting these embryos, we always discuss with you the pros and cons of putting multiple embryos, and then take a decision. So again, you need not worry about having twin pregnancy always with a IVF treatment. And one more misconception what couples have is that every they think that every couple have the same kind of treatment. Again, it is not right. IVF treatments are patient tailored, or we can say they are customized treatments. Every couple we evaluate in detail, and plan a special or a specific protocol for them. Before taking for them IVF, we prepare them 1 or 2 months prior, depending upon their profile, and select the best protocol which is suitable for them, which can give maximum benefit to them with less stress and less financial assistance. What you say, finances. So as much as possible, we try to customize the treatment for that particular couple and give it. So treatment for all couples is not the same. It is always depending upon the profile of that particular couple. We have to consider both the male side and the female side and design a separate treatment for every couple. So these are certain misconceptions what people have about IVF. So I think I have tried to clear many of these misconceptions in my talk today. If you have any further questions or doubts, you're very much free to ask me. So you should always remember that IVF is a treatment which helps many couples to fulfill their dream of parenting a child, and you need to take a right decision on right time so that you don't miss that golden period. Once you take a decision after that golden period is gone, even after putting a lot of finances or your emotion into that treatment, it may not give us an optimal results. So instead of being in these misconceptions and postponing the treatment, it is always better for you to discuss whatever doubts you have with your concerned doctor and approach a good IVF center which have all the advancements, and get the treatment done on time, so that you don't regret later that you have lost a chance to conceive with your own gametes, or you have lost a chance to conceive completely uh, uh, for that time, and you had to go for either third party or adoption. So right decision on right time is very important in getting these IVF treatments. And among all, the age of the female partner is the utmost important, which determines the success rate of the IVF treatment. Even the age of the male is important, but for male, it is until 45, it doesn't affect much. But for females, for women, especially for Indian women, again, we can't compare Indian women with the Western population, where for them until 40 it is okay. But for Indian women, especially for South Indian women, it has been shown, or we have enough research, that Indian women ovaries get older quickly than the Western population. So we need to take little quicker decision before 35. So for some women, even before 30, we have to go ahead with IVF treatment. It's not like because you're young, you're less than 25 years, you don't need IVF treatment. No, there are certain conditions. Even though you're 25, even though you're 23, you may have to undergo IVF treatment to save your reproductive potential. So it is always good to be little cautious than negligent about these things, because eggs and ovaries, they cannot be rejuvenated with the current technology what we have. So taking right decision on right time is very crucial for the success of IVF treatment. So always discuss whatever doubts you have with your concerned doctor, and time and take timely decision.